Melinda.
Brittany.
Brian Sr.
Olivia.
And my name is Brian, and today we'll be covering kind of some misconceptions around CPR, and then the chances of success and some other information that might be important for people to get. So I guess the first thing I kind of wanted to cover is that there's a lot of unknown or misconstrued information regarding giving CPR. A lot of people kind of have this idea that it's a lot like it is on TV, where, you know, the doctor will rush in and he's compressing like as fast as he can, like a madman, and then the person spontaneously just comes back to life and they're okay again. But the reality of it is that it's not like that at all, especially in a pre-hospital environment. The success rate for CPR comes down to something like, on average, 15% success for whether you're ever going to actually get that person back. There's also a lot of unknown, misconstrued information revolving around how CPR is actually given by civilians as compared to EMS professionals. And knowledge of this information may actually prevent people from dying in a pre-hospital environment, and may actually cause more people to be able to participate in potentially saving a life and seek the training necessary. So some overall statistics kind of wanted to cover. Heart disease overall is actually considered the number one, if not one of the top 5 causes of death for every single age group. And that's according to the CDC. So, and your chances of dying from a heart disease related attribute actually increases as your age increases. It's responsible for roughly over 500,000 deaths a year in the geriatric age group, which is 65 and older. The next thing I kind of wanted to cover is what damage occurs to the body at certain time frames. So within roughly 4 to 6 minutes, brain damage will start to occur without circulation of the blood throughout the body. It's suspected at that point. It's not for sure, but the body only has a limited amount of supply that it can continue to give itself after the heart stops pumping. Once you get into the 10-minute range, brain damage is going to happen regardless of anything else going on, which means that that person is going to have a completely altered life from that point on, which is why it's so important for people to begin CPR as early as possible. Like I said earlier, the success rate of CPR in a pre-hospital environment is only 15%, which is incredibly low. A lot of people don't realize that the chances of you getting a person back in the first place are low from the get-go, which is why it's so important to begin early. Now, some of the ways that this can be improved are people actually knowing what they're doing. Civilians often believe that CPR for them involves giving breath to a person mouth to mouth, but that's actually no longer required. Civilians are encouraged to do what's called compression only CPR, which means they're not actually giving rescue breaths. They're simply compressing the heart down at an appropriate rate of 100 beats per minute. The body actually retains oxygen inside the blood for upwards of 10 minutes, and the response time for EMS personnel is roughly 6 to 8. So by calling 911 and getting medical professionals on site and beginning CPR early, you have the greatest chance of keeping that person from ever getting any brain damage, and you increase the chance of that person ending up surviving. Some other ways to improve it are through a lot of initiatives that have been started by first responders, such as the placement of AEDs in the public setting, and training people how to actually do CPR, such as letting them know that they can do compression only, so that they don't have to risk coming into contact, with their mouths to another person that they don't know, and potentially getting, an unknown disease, such as that if that person has herpes or AIDS or any other communicable disease. Another way to improve it is early implementation of CPR, which I've mentioned several times. Like I mentioned, that 4 to 6 minute window is when brain damage can start to occur, but by starting the circulation of the blood, you can improve that person's time from 4 to 6 minutes without CPR to 10 to 14, in which time that they won't actually receive any brain damage, and they have a greater chance of actually becoming resuscitated from continued efforts. Another important thing to cover is training the public at large. A lot of people have taken CPR classes, but they're never really refreshed on them. They've taken a class early in high school in which they were probably taught how to give the rescue breaths, or they were taught, at an earlier point, but they don't remember a lot of the things that they were taught, such as the correct compression rate. And whenever they do their compressions after coming back to it from a long time, they're off on how their timing is. So they won't actually compress at a rate that's sufficient or is overexerted. Another thing is actually getting the AED training. A lot of people were taught how to do the compressions and the breaths, but they were never actually taught how to use an AED, which will, again, greatly increase the chances of that person making it out of that cardiovascular event. Another thing is early activation of the EMS system. So there's a misconception that whenever you see a person drop from, and you go up and you check their pulse and they don't have one, they believe that you should start CPR immediately. However, if you actually witness the event, you're actually supposed to call 911 first instead of beginning CPR. And then after you've actually called them, you begin CPR. If you don't witness the event and you find the person passed out, that's when you begin CPR first, continue through 5 cycles, and then call 911. Another one is encouragement of people to act rather than onlook. A lot of people, again, probably because they haven't actually been trained or because they're scared to actually intervene because they don't want to come into contact with a person that they don't know, they'll actually onlook instead of actually assisting the person. And so when EMS personnel arrive, that person may already have received significant amounts of brain damage or may have already been sitting without any resuscitative efforts for upwards of 8 to 10 minutes, in which time that person's chances of resuscitation drop dramatically. So places that have actually seen results as far as improving people's chances of survival are places like Seattle, Washington. There's been huge campaigns to push for people to actually improve the amount of training that they have, and they've had widespread placement of AEDs in public settings. And because of the availability of training and the number of people that are trained, the percentage as far as how successful people are whenever giving CPR has increased up to 30%, if not higher, in some areas of Seattle. And in the hospital setting, it's improved to roughly 45 to 50. Another place is the UK. The UK has tons of initiatives that have pushed for people to actually get the training and have different medical levels of certification. Because of that, their numbers are roughly the same as Seattle, if not higher, in areas such as London. In conclusion, I think the U.S. at large is lacking in a lot of initiatives to push for AED placement. While there are some, there's not a whole lot of areas that actually haven't, and especially in some cities that have on average lower income, such as Detroit, the rate of survival is roughly only 2% in a pre-hospital setting for CPR. So getting the initiatives in place for people to get the proper training and actually know how to use AEDs and the placement of AEDs so that they can actually be applied while people are attempting CPR will vastly improve the number of people that are able to be saved whenever cardiovascular events are triggered. Another big thing is that pedestrians make the difference whenever it comes to this. Pedestrians in general make the difference whenever it comes to people having to receive CPR. EMS personnel can arrive in 8 to 10 minutes, but if they arrive in that time frame, the person's already more than likely received significant amounts of brain damage, and their chances of survival drop below that 15% threshold, which is already incredibly low. Other than that, preemptive healthcare, as far as making sure that you are in good health with your heart and the circulatory system of your body in general, is going to increase the chances of you surviving in general by preventing you from ever having an event triggered in the first place. That's it. I appreciate you guys for listening to me, and thanks again.
Thanks, Bob.